Have the Center for Medical Interoperability in Nashville. And these are precisely the kind of issues that they work on. And of course, what we have learned with healthcare innovation is that payment processing can be standardized and efficiencies achieved in payment processing, and also, as you said, in finding that definable data that is necessary for that claim. And we should use every piece of technology that we can to speed the claims to our veterans. Mr. Lawrence, I want to, first of all, congratulations and thank you. And thank you for the time to visit. I want to go first with you to the backlog on claims, because you got the number down the lowest that it has ever been, and you mentioned that in your opening remarks. And what we see now is an enormous claims backlog. If you look at the claims that are under 120 days and also over 120 days, it is 954,000 claims. So what I would like to hear from you is what steps you're going to take first and foremost to get those claims, those numbers down.
Certainly. Thank you for the question, and I enjoyed our visit very much. I guess what I'll begin with is going back and, if confirmed, talking to the folks over there and reviewing what's taking place, because part of how we got it down to such a low number is through a series of process activities and technology activities. And
what was that number?
It was less than, it was 64,751.
Okay. 64,751. Okay, let me ask you also, and we talked about this privately, 80% of the VA employees are unionized, and they are some of the ones we have heard that have fought going to EHRs, and they have fought returning to work full-time. So in order to address this backlog issue, how are you going to deal with these unionized employees and get them back in the office so that they are processing those claims and have them adapt using the EHR system that is there, that now you've got Oracle handling that contract?
Certainly. I think the Secretary, when he was here, talked about this very directly, which is we have to explain that the mission of the VA is to serve veterans, and that is our focus, and that is what we need to do. And anything that distracts from that has to take second place to that. So if that means getting back to work, so be it. If that means coming to the office, so be it. We have to understand that, you know, these distractions take away from our ability to deliver care and benefits to our veterans, and we need to minimize those and refocus activity on what the mission is.
Now, last week, Secretary Collins let us know that the community care network contracts are going to face delays because of some obstacles that were put in place during the Biden administration. We've got a lot of veterans in Tennessee that prefer community care. We've got 95 counties, 90 are rural counties, and they prefer community care. So I would like to know that you all are going to continue to push to get these contracts back on track for the community care network. And I don't want our veterans to see a disruption or to be displaced. So do we have your commitment in that regard?
Yes, if confirmed, I'll work with the Secretary to follow through on his commitment to you and help him in any way.
And then the first hearing we did here in the VA committee was on community care and simplifying this, getting a pilot project in place so that the veteran is making the decision on their care and not having to wait on the VA and a caseworker there who's working remote, working 5 days out of 10 or 2 days out of 10 in person to make a decision to allow them to have the care they need in the location that they need. And I would like your commitment on providing the veteran with that decision-making authority instead of having that land with the bureaucracy in the VA.
Thank you very much, Senator. If confirmed, I'll work with the Secretary on this. I know that he spoke about the importance of choice in his conversations, and so I want to make sure I'm aligned with that, but I think we are. So yes, we'll work on this together.
Thank you so much. I yield back.
Senator Duckworth.
Thank you, Mr. Chairman.